Right now, I will talk about all the cancer treatment used by big hospitals in the world. This picture shows the lady on the chemotherapy treatment. The first one is surgery. Surgery removes cancer from your body. Learn the different ways that surgery is used against cancer and what you can expect before, during, and after surgery. After going through all this treatment, I will share my own experience. Radiation therapy is a type of cancer treatment that uses high doses of radiation to kill cancer cells and shrink tumors. Chemotherapy is a type of cancer treatment that uses drugs to kill cancer cells. Immunotherapy is a type of treatment that helps your immune system fight cancer. Targeted therapy is a type of cancer treatment that targets the changes in cancer cells and help them grow, divide, and spread. Hormone-therapy is a treatment that slows or stops the growth of breast or prostate cancers that use hormones to grow. Stem cell transplant are procedures that restore blood-forming stem cells in cancer patients who have had theirs destroyed by very high doses of chemotherapy or radiation therapy. Precision medicine helps doctors select treatments that are most likely to help patients based on a genetic understanding of their disease. Here I will talk about my own cancer and my own experience about some treatment I mentioned before. Around 2012, in August, I had my first surgery. My cancer is called chordoma. This is a definition. Chordoma is a rare type of cancer that occurs in the bones of the skull base and the spine. It is part of a group of malignant bone and soft tissue tumors called sarcomas. Chordomas account for about 3% of all bone tumors and about 20% of primary spinal tumors. From my research about a few years ago, on average, there are 300 new patients every year in the US. Also, 300 old patients will pass away. This dimension in this cancer is very rare. It's a very rare type. Only 1 in a million can get this cancer. I'm the super lucky one. I'm winning lucky draw basically. I will talk about a little bit about my own experience. For the surgery, my first surgery and the second surgery both at Johns Hopkins. The doctor is very good. He is one of the best one in the world. He had a very strong hands-on experience because he did so many surgeries about this kind of cancer. I found him from Facebook. Right now, I search again. He transferred to a large hospital in Chicago and formed another department with 2 more famous surgeons. I will not do surgery again unless it is very necessary. For the radiation therapy, I consulted with a proton therapy in a different state. Even I live in Utah, there is no proton therapy facility at all. One famous facility is in California. They are very good. I called them. They want my image, but I never went there. Another one, they are building one in Maryland. It's related to Johns Hopkins. There are a few of them. If you are interested in proton therapy, you can do some Google research. I think they are have more of this proton therapy, because from what I read, proton therapy is one of the best, very effective. They target on your tumor very effective. Also, they will minimize the side effect. For the chemotherapy, I'm not a big fan. Because my tumor is not effective, so doctor never asked me to do the chemotherapy. But for the radiation after my surgery, because the doctor never did any treatment, he asked radiation department to do radiation. When the doctor talked to me, I feel so scared because they will shoot the beam past my throat. I cannot eat for a few days, so I never go there again. I just disappear. For the chemotherapy, I want to talk a little bit. Even for this kind of cancer is not effective, but my friend in Singapore, he is a rich man, really rich, among the 10 million US dollars in his bank account. He's very successful, not only in money, but he's very successful in his career. But he got this same cancer as mine around 62 years old. After his surgery, but his tumor is very small compared to my size. After his surgery, his doctor asked him to do a 3-round chemotherapy. At that time, he was in Singapore, I was in the US. Then I emailed him about his condition. In the beginning, he showed his picture in the hospital, very thin. The condition looks very poor. Then after a few months, he never replied my email. Then his wife replied to me, "Oh, he passed away. You should not email him again." I feel so sad. I believe his 3-round chemotherapy killed him. He passed away after his surgery. A few months later, even his own daughter is a doctor at Singapore hospital. Is a registered one, because he is so confident about that doctor. Basically, that doctor killed him. But he is also needed to do his own research. He need to make his own decision. Even he got a lot of money, he worried about there's no insurance in the US. I asked him to use the same surgeon. He performed that surgery for me, but he worried about insurance. He's so rich. A very sad story. For the rest, I think immunotherapy is good, because basically, if our immune system is strong, you can fight against cancer. For the rest, they are quite new. Homotherapy, basically, from the diet, we can control our hormones. This one I never used before. So right now, I share a little bit. In the next video, I will talk about natural ways to fight against cancer, because right now I focus on using natural ways to control my cancer. This is my 7th year to fight cancer. I found out water-only fasting is the most effective way to control my own cancer. Also the diet, the raw food diet, also a little bit beef liver, maybe a little bit of fish, and a little bit of protein is okay. But some doctor mentioned there's should be only raw vegetable-based diet. There's no protein at all. But I disagree a little bit. I do control my sugar, carb intake. I try to minimize my flour, rice, and the processed oil, all these kind of bad things for cancer patient. I'm very happy to share my fighting cancer experience. See you in my next video. I will talk about the natural ways, all the natural protocols developed by other scientists to fight against cancer. I used most of them.